And that surge also having a frightening impact at local hospitals. Dr. Frank George on the front lines, of course, in the emergency department, and he's got a rather sobering update here. Doc?
Yeah, Kim and Devin. So the past several shifts that I've worked in the ER, I have seen a very clear increase in COVID patients, and many of them are needing to be hospitalized. I would honestly say this feels worse to me here in Southeast Michigan than it was during the wave that started back in November. And now the most concerning trend is in the number of middle-aged people with severe COVID.
We currently have about a quarter of the patients who are hospitalized at our main hospital are actually in the intensive care unit right now.
Dr. Geneva Tatum is a critical care medicine specialist in the ICU at Henry Ford Hospital in Detroit.
We've seen a shift to a little bit younger age group. There's about 5 years or so younger than we've seen in the past.
The state's data as of 7 days ago shows hospitalizations have taken a sharp increase, with a growth rate that is possibly more severe than the increase we saw during the winter surge. Cases are now doubling in under 2 weeks, and the concern is that this will lead to even more cases in the ICU.
We know that a lot of our patients who get admitted to the medical ICU get admitted because they get worsened while they are actually in the hospital. What we know is that patients, almost irrespective of age, thus far, when they've gotten critically ill, they've required a lot of high-level, very advanced care for prolonged periods of time. The fact that they're critically ill and in an ICU means that they're going to have pretty much a protracted course. And so again, anything and everything that we can do to prevent them from getting so ill that they need to be in an ICU is where our focus really is.
Now I'm going to editorialize a bit here. There is a surge in Michigan. It's obvious to us on the front line. Now I'm not sure what action the governor or health department can or will take, and if things do stay open, that's great. But that means the responsibility is on all of us to curb this. Just because things are open doesn't mean you have to go if it isn't necessary. And be sensible. Protect yourself and others. Remember, freedom comes with a cost. Let's pay it by acting responsibly, and don't let the cost be lives lost to COVID.
Yeah, Frank, this is really interesting. I think a lot of people are trying to figure out why we're seeing a surge in Michigan, but not in other states that actually have far fewer restrictions in place.
Yeah, unfortunately, I don't think anyone really knows the answer to that. If we did, maybe we could do something about it.
Yeah.
Frankly, it might be because of increased variant transmission, but that's still a best guess. One thing we do know, though, is that when we've seen surges like this before, they do not stop unless people change their behaviors. And in the past, it's been because of a lockdown. Back to you.
And it continues to put a premium on the vaccine efforts, no doubt, which we'll turn to now. All right, Frank.